Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi, and I really want to thank all of you guys for tuning in to 1250 KKDZ, Desi 1250 AM, and the topic for today, Dr. Anju?
Yeah, so today's topic is really interesting. Like we have talked in the past about the overweight a lot. So we thought about like a lot of people do struggle with the underweight. That's a problem too. It's not a very big problem as the overweight is in this United States, but there is still a population which is suffering from the underweight. They cannot gain weight.
Right.
There could be several reasons for that. So we decided to discuss that today.
Yeah. I think all those people who are underweight and have heard from their parents or their friends or brother, sister, you should stay tuned in today because that's what we'll be covering in next this show. And in order to call us at the studio for if you have any question, please call us at 1-844-301-1250. Again, 1-844-301-1250. This is a direct line to the studio, and we are telecasting live from the studio. So I really also want to thank all our listeners who personally have come to us and given some different ideas about the topics. So we love that. We love to hear from you, and we like positive and negative, all the whatever input you like to give to us there to make this program more interesting. We always enjoy that. तो आप हमारे साथ हिंदी, उर्दू और पंजाबी में भी बात कर सकते हैं. ये शो जो है, आज का जो शो है, जैसे डॉक्टर अंजू ने बोला कि अंडरवेट जिनका बहुत भार कम रहता है या पतले हैं, पतले दुबले जिन्होंने ये सुना होगा, तो उनके लिए है ये शो. बट यहाँ उन लोगों के लिए भी जिनका भार बहुत कम हो गया एकदम अचानक किसी वजह से, तो हम उस टॉपिक को भी इस शो में कवर करेंगे. सो हमें कॉल करने के लिए आप जो है 1-844-301-1250 पे कॉल कर सकते हैं, 1-844-301-1250. So Dr. Anju, like you said, there is a really majority of population is obese and overweight. So that's the reason why we picked up to go with the underweight people, because I think that's a small segment of the population which really struggles sometime. And the statistics shows about 2% of the population that really suffers with the being underweight, and there are various reasons why people are considered underweight. So the underweight, if we go and define as a terminology, any person whose body weight is considered to be low below the healthy range is usually about, if you weigh less than 15 to 20% below your ideal weight, you will be normally considered underweight. That it has to be your height weight proportion. That usually we think that people should have their weight should be according to their height. So if they are either over or under, then you can be either overweight or you can be underweight. So that is the definition. So we also sometimes people go with BMI, which stands for body mass index. Again, that's a calculation is based on the height and weight. Like Dr. Anju was saying earlier, that it's a very small segment of the population which suffers. And I have seen, Dr. Anju, even patients in our clinic who have came either from our East Indian population or even the local population. I have seen.
Yeah, many times like people come and they are not sure, like they are eating, they come and tell that their eating habits are good, they are eating enough, and they are not able to gain weight, or they keep on losing weight. A lot of the children I have seen of ages like in the teenage, they are not there. So there can be several reasons for that too. Sometimes nutrition, like the kids are really picky in eating and they are not eating properly. That is the one cause. And then there can be some underlying cause too. Like many times at our office, we encourage people to have, like, once the kids are like in their teenage, it's important to do the a blood test, which usually people do not take the children to the or they do not like to get the blood test done.
No.
So if they are not getting a blood test done and they are keep on losing weight and they're not able to gain weight, we need to look for the several factors, like the thyroid is one of that, and then the maybe not enough iron level, or some vitamins and minerals, the B vitamins can be seen. So it's important to do a blood test.
Thorough checkup.
Yes.
So, one of the things which you brought up with the young teenager or young kids, sometimes there is a growth pattern that the kids are growing such a fast pace that
Yes.
they look thin and underweight. So, that's why it's very important to have them evaluated to make sure if it is a normal growth pattern, as body will catch up and the body will gain some muscle mass in normal conditions. In other times, we really, like you mentioned, we need to make sure there is not underlying factor which is keep on making them look skinny or underweight. So, there are, like Dr. Anju mentioned, a person may be underweight due to genetics. That's another thing which people need to know. If they seen in their family, if the parents or grandparents are on the the thin side but fairly active in throughout the life, and that may be very normal for them. So but again, there can be certain things can be done to gain a muscle mass on, and we will cover that. And then there is also other reason could be metabolism, that their metabolism is either too fast, or sometimes may be having a digestive issues. So that could be reason for being underweight. And sometimes the people who are on different drugs, that can also lead to underweight as well. And then, like Dr. Anju, you mentioned about the lack of food and lack of nutrition.
Yes. So, like, a lot of times we even like with our own children too, sometimes we notice like once the growth spur, as you talked earlier, like Dr. Shailinder mentioned. So growth spur, like they start gaining height in their teenage, and then and they are very picky. Kids are very picky. They do not like to eat properly. And they will take the food to the school, but they will not finish it, and then then there is like not enough calories, and because of they are gaining height, and
not enough
calorie intake, they do not gain weight. So so that is like a normal behavior. A lot of times we see. So that in that case, we need to, being parents, we have to encourage our kids to eat properly, eat enough calories, and make sure they are eating the healthy food. That is very important too. If they are kids like to eat sometimes the junk food, and the school food is sometimes not like the
most healthy either.
So So there is a lot of factors need to pay attention.
And sometimes I think not only one, that's one of the reasons what we maybe might indicate that why the kids are, underweight, or even the adults can be underweight for the same reason if they're not paying attention to the nutrition. But sometimes it's a lack of, the nutrition is because of the financially, the families are poor and they cannot afford to have healthy food, and that's another. And we see that also worldwide where there is a lot of difficulties, either because they don't have enough food to go around or political situation and all that. So those are another reason
that
for
that is right.
And then there is illnesses, and that is uncommon to, that's the factor which really becomes very bothersome for a lot of people. And if you have something underlying factors going on, and that can cause a very severe weight loss, it needs to be looked at.
Yes,
it definitely need to be looked at. Like certain medical condition, like you mentioned, like a thyroid condition or a hyperthyroidism, or cancer can be the other scary thing which can cause it. Tuberculosis or some digestive like celiac diseases and diabetes.
Celiac disease, like that is getting very common these days too. So many times, like there could be in the celiac disease, like body cannot handle the gluten. It's absolutely no gluten should be into the food. But then there is a lot of people have like it's a allergen. Gluten is these days it's like all the GMO and stuff. It's considered as a allergen. So if they are not eating like they are eating white flour, they are the fiber is not into that. Mm-hmm. That can cause the problem too. Like they are allergic to it, or not allergic, or maybe sensitive. The body is sensitive to the certain food and they are not absorbing it.
So that becomes an issue of nutritional deficiency.
And
like you mentioned, the celiac disease is, it's fairly common.
And if it's not, if it's not treated, then it's a problem.
And a lot of folks, if you're paying attention to our conversation, celiac disease is easy to diagnose. Yes. It's a very easy test, blood work, and it can show very quickly that there is a gluten sensitivity or not. And the people who are seriously have a celiac disease, these are the people who are having very hard time in gaining weight or muscle mass throughout their life. So that can be just addressed by correcting this just simple thing.
By not giving the gluten in the diet. And these days it's not a problem. In the old time, the gluten was the main. If we are not eating roti, what we're gonna be eating, and there is always I make gluten-free roti all the time, and there is so many good gluten-free flours can be used, and there is a lot of gluten-free options available. So it's if that is the weight loss is due to that reason, it is easily can be taken care.
I think Dr. Anju, I would like maybe at the end of before we end the show, give some choices for these type of individuals, what type of food they can have to especially the people who suffer with gluten sensitivities or celiac disease.
Yes.
So there are two different criteria for the celiac disease. Celiac disease is definitely a gluten sensitive allergy. These people just cannot have gluten in any form, in any shape. They cannot handle gluten. And then there are people who are gluten sensitive. They are not really celiac, but they are sensitive to the gluten. And these people also have hard time gaining weight.
Yes, because they cannot digest it.
Right.
So then they are not able to and the symptoms folks need to pay attention is if they are if your kids are or yourself, you're complaining about the abdominal pain after eating, or a lot of the gaseous or the bloated feeling after eating. These are some signs, or feeling sluggish, or you are anemic. Celiac patients would be anemic too.
Right. They just don't have a good absorption, and this is a common thing. They look pale, yellow, thin structure, who have no energy, and their daily activities, part of it, there's a burden for them to do even small type of work. So, if you know somebody or if you have this issue, you definitely need to make sure you come and make an appointment and see the doctors, and to make sure that you do not have a celiac disease. The other things which also in the thyroid, hyperthyroid, sometimes that is a condition which get developed over the time for no known reason. Sometimes it's an autoimmune response, or sometimes it's you just had some virus, and next thing you know is that thyroid got affected by it, and you can get a hyperactive thyroid, and that usually lead to a all of a sudden immediate kind of weight loss in these individuals too, and they develop again digestive issues can be issue. They feel very hot, and their appetite and all that could be, and they can have a diarrhea and all that type of stuff. So they're not digesting food. So and again, it's a very simple fix.
Yeah, so it's important to do the blood test and figure out if the thyroid is functioning properly. If you feel that your kid is not gaining weight, and it's or they are like feel tired, or like they are not like the other children.
Right, and so that this is important that you need to have an evaluation done and get yourself checked why there is a weight loss. Why there is a couple things which we really want to make sure. One is one thing when we talk about the pediatric cases or the kids case. Sometimes there are other issues for the pediatric issues, like they have a hard time for thriving to survive. So those are different issues, and we definitely want to separate that out. And that could be sometimes genetic factors could be playing role, because these individuals just have genes which they have a hard time digesting food or anything. So they need to be looked by the nutritionist as well as the doctor who are competent in advising for proper nutrition in the small kids. And that could also be the reason in the adult case too. And sometimes individuals which are suffering for and do not even realize that they have underlying diseases, they need to be carefully examined and make sure that their body mass index is according to their height and all that. So it is important. And sometimes, Dr. Anju, like said, some people are totally healthy, and all of a sudden they notice that within 2-3 months they have all of a sudden they start losing weight, and they start losing muscle mass, and their energies are really drained. Those individuals definitely need to be looked at. Yes. We need to really make sure what really caused that type of weight loss. It could be as serious as they might be having underlying cancer, which need to be looked at, and and they could be diabetic, which there could be other things which need to be looked at. So the individual, if you don't know what might have caused the weight loss, if you are not trying to lose a weight, and there is unnecessary weight loss, there is usually a reason why that is happening, and that reason need to be found. Yeah. And that's why it being underweight is sometimes becomes an immediate concern for the doctors to see it. So I mean, once that underlying factor is corrected, majority time people will be able to gain their weight.
Yeah, and then other factor is like the anemia is the another one. Mm-hmm. Like the thin, like the not able to gain weight. Those people are usually anemic too. So that again, like by evaluation, we can figure out like what is the deficiency, the iron deficiency, and they should be either taking a supplement or increasing the iron through the food, eating greens and the other vegetables and the apples, like to increase the iron intake, or cooking into the iron pot is important too for those individuals. So, and then if they are anemic, and then they can have some like the other problems due to that too, like they are feeling tired all the time due to anemia too, and then they are not able to gain weight as well.
Yeah, the tired and lack of stamina,
yes.
And immune system also gets weak.
Yes.
And these are the people who are constantly saying, first we are not really physically strong, we feel weak, we are underweight, and we get sick easily. These are the most common complaint these individuals come in to our practice, which I have seen, and that's because the immune system get compromised because of the nutritional deficiencies. Your gut is not able to absorb all the nutrient whatever you eat, or sometimes you're just not eating right type of food, or you're very selective eater.
Yes. And then comes the hormonal disturbances. Like if they are not gaining weight due to several reasons, then their hormones are not behaving right way too.
And especially in the women.
In the women especially. And then the infertility is a major issue in the women who has this issue going on.
Right. And the one thing the women I think also need to know is that they are their cycle, the menstrual periods they're missing.
Due to that, the menstrual cycles are not regular, and then that causes to the infertility into the women patient. So it need to be seen.
Right. So, folks, we are discussing about the underweight conditions. And, if you like to call us, if you have a question, feel free to call us at 1-844-301-1250, 1-844-301-1250. And we will take a short break and we'll be right back.
Hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
All right, folks, thank you for coming back again to and staying tuned into today's show. So we are discussing about the underweight, or the people who have hard time gaining weight. So before we took a break, we were discussing few conditions which can lead to or cause weight loss, or people who are underweight. Certain conditions can happen, like Dr. Anju was mentioning earlier that people who have nutritional deficiencies or anemia and all that, especially in women, they have fertility issues as well as the menstrual cycles are not regular. So or also even if they're pregnant, if their nutrition intake is also not there.
That is true. Like, because if they have this issue to begin with, and then they have they conceive, and then they are still not absorbing the food they are eating, and the women do not know what is the reason for that, then it becomes complicated. It can give a lot of complications during the pregnancy.
Right, and what that actually leads to that malnourishment and anemia actually sometimes can cause intrauterine growth retardation, IUGR we call, or the baby does not develop as expected, or when they are delivered they are very underweight, and they look, or sometimes premature deliveries can happen because body is not able to deal with the whole pregnancy issue. So that's another whole lot
different topic.
Yeah.
So but it can be corrected. So that's what we are trying to say today. And then a lot of women also in the men's too, like if they are not absorbing, if it's due to the malabsorption, then they will be having other issues like the loss of hair. Then that's the big issue, like why I'm losing hair, and then
that could be very much early sign,
and
yes. Especially though it can happen in both sexes, male and female.
And I got a lot of patients, women patients especially, for the hair loss, and by just changing the diet and by adding some supplements into their diet, I can really say that I had a good success rate.
Right, and the other thing with when these individuals is also being underweight, they have a risk factor for osteoporosis.
Yeah, that is for our like the old patients, like
As
the
well as
old
the
individuals,
old
and
as well the young
well
as-
as the young too,
Right.
because they are not absorbing. There is the calcium, lack of calcium into the body, and that if they are not don't have the enough vitamin D level in the body, and vitamin D is important for the absorption of the calcium too.
Right.
So
The one of the thing, Dr. Anju, was this, even this behavior was noticed, osteoporotic, or where the bones were weak, was even seen in the athletes, even those female athlete who either have a eating disorder or they were working out excessive exercise, that not only led to amenorrhea, that means no menstrual cycle or hormonal changes, but that also led the change into mineral density in the bone, because they were an ovulatory phase. That means they did not have an ovulation and they were not having regular cycle. So the hormones are also needed to put the calcium back into the bones. And the women who actually were doing, even they were saying that we are athlete and we are at competitive level, even the osteoporosis was seen in those individuals because of their lack of nutrition. They did not kept up the amount of caloric intake or the healthy diet they needed. So that's another complication of being underweight. So which is really scary. I mean, when you're osteoporotic, you have a more chance of breaking bones. You develop fractures, and if you know somebody, or if you have noticed that you are one of those individuals who's get fracture easily, then you need to pay attention. You need to be seen. So the one of the thing which we really want to make sure that all the listeners, it can happen to any type of individual, and you really don't have to be
so this is like we talked about, like some of the few, like that could be the underlying cause for the weight loss. And Dr. Shailinder, you want to discuss a little bit about the other thing, like anorexia and the bulimia,
right? I mean, there are physical part which there are we call a psychological part, emotional part as well. And like Dr. Anju, you brought in a very nice thing about the anorexia. This is a behavior which actually requires attention right from the early. Some of the, it is a, it's a, we call it a part of, people who think they need to look thin, and they are never satisfied with their look. That's one of the reasons why the anorexia develops. It is a cultural, could be cultural, where the kids are growing in a way where they want to look very in a particular way. So anorexia is a psychological and possibly life-threatening eating disorder, and it is usually defined by the extremely low body weight. And their BMIs are extremely off, and they are so underweight that these people cannot even walk sometimes. The severe cases which I have seen, they are so much anorexic because they do not eat. They starve themselves, or if they eat, then they will find another way of either throw up or cause a vomit to themselves because they feel guilty about eating. So it is always, they have issue around the food because they want to look very particular. So, that's a reason. And these individuals, the anorexic, are the people whom you will see, they're really, their muscle mass is they don't have any muscle mass. They are just part of bones, usually. And these are the individuals who have illogical fear of weight gain, and also have distorted perception of self-image and body. So they need, even for you, if somebody look at them, they will say that you are emaciated. That means you're really don't have any, body weight. You look so thin. But to that individual, they still see themselves that they have a lot of weight on themselves. So this is a behavior
This is a behavioral, psychological issue.
Yeah, and the problem with this structure, that it is, women and men who suffer from anorexia, they have, usually this eating pattern issue where they can either eat very little or totally avoid food, or if they eat, then they try to throw up. So there is two types of anorexic behavior, and which are usually either we called one is a binge or purge type. These are the individual who suffer from this type of eating disorder. He will purge when he or she eats. So that's the one of the sign, and parents have to be very careful if they see that type of pattern in their child, in a or in a girl or a boy. They need to address it. They need to bring into the attention of a doctor, or sometime there may be we need to have a counseling evaluation, psychological evaluations done, because they typically do this because they have overwhelming feeling of guilt, which experience in relation to the eating, and they compensate by vomiting, or sometimes they use excessive laxative or excessive exercise.
Yeah, that is the another one, because they just love to keep on going
because they think they have eaten, they need to burn it.
Yes.
So they don't gain a weight.
Yes.
So that is the compulsiveness and excessiveness into this behavior pattern is a classic sign of anorexic behavior. And then there is a restrictive anorexia. In this form, the individual fiercely limit the quantity of food consumption. That means they do not want to eat. They really will eat very tiny amount, and characteristically ingesting a minimal amount that is well below the body's caloric need. So effectively slowing and starving or him or starving herself. So they will just starve themselves. So both type of classification requires quite a bit attention from the doctors as well as from the family members, that they need to bring this individual so they can be taken care.
And these type of individuals usually are not willing to go to the physician.
Right, because they have irrational fear of body weight gain, and they do not. And so there is a lot of counseling is needed. The constant visits are needed, and there is some studies done. What are the causes of anorexia? One of the most cause of the anorexia is that these people have these are kind of thinness in the culture, right? They want to look into. So I see sometimes those shows, fashion shows, where people, you say, really?
Yeah.
Can I imagine that person to be walking on the aisle and doing the fashion show, and they are emaciated? And so recently I studied, it was a news that in France, they are discouraging those type of models to be brought even on the stage, so that next generation kids do not see that as a role model.
Yeah.
They are trying to change that pattern. So that is the perceptive. That's a perception. We need to look at. Thin is good. Thin is sexy, or thin looks, we need to be that. So that behavior pattern is one of the reason why people become anorexic
or the bulimic.
And that's another we will discuss at that. And sometimes there are profession and careers which promote being thin and weight. So like in ballet dancing or the modeling, these are the people sometimes and that is very unhealthy to do. And sometimes there are family and childhood traumas, childhood sexual abuse, severe traumas, which lead to this type of behavior. And that's, again, can be corrected and addressed with the proper counseling, and sometimes nutritional approach and the deficiencies which can be addressed, and these people can live or lead a normal life. And then there is a peer pressure. You live in among the friends or co-workers who always kind of supporting or promoting being thin and sexy. So that is the reason why people become anorexic. So some of these things which we mentioned is it leads to hormonal imbalance. Usually women are more sufferer in anorexia.
Yes.
And that's lead to the major issues with them.
I think it's the women are the more than the men, I think, in the anorexia or the bulimia condition.
And there is a link. Sometimes they say there is always a link of genetic reasons, which may be some individual are more prone to anorexic. It is open to debate, and I can believe there may be some reasons or some maybe genetic or could be reason why these people are more prone to have anorexic behavior. And what we need to pay attention to is the nutritional deficiencies in these individuals, because they lack everything in their system. They are nutritionally very, very deprived from every thing you can consider, and their digestion is very weak as well because they never eaten. So these type of individuals need a very specific diet and with the counseling as well.
Yes.
So that, and then Dr. Anju, you mentioned about the bulimia. So bulimia is a little bit opposite side of the anorexia. In this case, is a condition where people are binge eating. So they don't have a control on eating. What they do, they eat excessively, and because they eat excessively, and then they feel guilty about it, and they
vomit.
They want to throw up. So these type of behaviors, which are if more common, if they every time they eating and they eat out of control and they throw up, you definitely have criteria which fits the bulimia. Yes. And this individual can be also underweight. So I think we have a caller on the line. Caller, go ahead. This is okay. I think the phone got disconnected. So anyway, that's okay. You can always call us back at 1-844-301-1250. Again, 1-844-301-1250. And we are talking about being underweight. So like we mentioned, anorexia and bulimia both are eating disorders, and they can be corrected with the counseling and constant, with the positive reinforcement.
Yes.
And other things which we need to, go under is when we are discussing about overall, these people who are genetically, known to be thin. So, and how you really want to address these individuals. People who are known to have, there has been a study indicating that these people have thin genes. That's why they look genetically weak. So is there a call again? Okay. Our caller, this is Dr. Shailinder Sodhi, and you're on the show Your Body is Your Natural Pharmacy. Go ahead. What is your question?
Hi, doctors. I actually had a question regarding how to gain weight healthfully when you are underweight. So are there particular food groups you should be going for, or particular food groups you should be avoiding? And how do you gain weight without it being too overwhelming on the body?
That's a very good question. And Dr. Anju, would you like to address that?
Yeah, definitely. This is a great question. And one thing I will definitely suggest, find out the reason. What could be the just have it like I don't know if you have listened to the show earlier, and what could be the reason for the weight loss.
So first thing is to find out the reason.
Find out a reason, like have a blood work and see if there is any issue with the anemia or hyperthyroid, something like that. So
or
then,
even as simple as celiac disease.
That is very important, that if you are it could be some people are just can't wait because they are allergic to the certain, or not allergic, or the sensitive to the certain food groups. And then again, just see how many calories are you eating, or if you are asking for someone, and if these calories are the healthy calories, that's very important. And the another thing, like if they are eating good calories and the enough calories, but then there could be, and there is no reason, no anemia, no hyperthyroid, no other issue, then there is could be a the malabsorption issue, that you are not, somebody is not eating but not able to absorb it properly in the gut. And we will be discussing a little bit about the Ayurvedic concept, which is great. Like Ayurvedic concept, it doesn't go with the numbers, but it goes with the constitution of the body. And this is like the Vata, Pitta, Kapha. We will be talking about that.
So, if what it is, I, call it that if everything else is normal, in a good scenario, I will say,
yes,
if everything else is, and you're still underweight, it's an indication that either your caloric intake is too low,
yes,
and you are not absorbing the nutrients out of the food. So for this hypothesis, where we will consider that you're a normal individual but underweight, you need to increase your caloric intake with the small meals more often.
Small meals, definitely, because when we are eating the small meals, our body has enough time to absorb it properly, and that helps. And then always there is some herbs too, which can help with the Agni digestive fire, so your absorption can get better. So that is the one thing need to be considered. And then there is some supplements, like great Ayurvedic supplements like ashwagandha, triphala, haritaki. These, because this is according to Ayurveda, this is an imbalance in the Vata dosh, Vata constitution, and that these herbs helps to balance that Vata constitution too. And your question was how to eat. So I will suggest that keep eating like the lot of fiber into the diet, drink enough water. That is another thing. Sometimes kids especially, or adults too, they are not drinking enough water, and that can be a cause for the weight loss too, especially in the summer.
The hydration is
very
the cellular
important.
Level. And also I think we need to
fats.
make good fats.
Very important that you are eating, or someone should be eating the good fats. When I'm saying good fats, it would be because when somebody is not gaining weight, we are not trying that they eat anything to put the pounds, because that would not be right. So good fats like the avocado has good fat, fish oil has good fat. There is a lot of the nuts
even
and seeds.
Ghee is a good fat.
Ghee is great. Ghee is great for because it's a Vata imbalance, and ghee will really help to balance that Vata imbalance or Vikrati. So I hope I gave some answer.
And I will also add the good protein sources.
Good protein sources, yes.
Is also needed, because the proteins are needed for the muscle. And along with this, I will always say there is a component of moderate exercise.
Moderate, especially when somebody has a tendency to not able to gain weight, and they need to see if they are exercising a lot, and that there is so many dear factors to see why they are not gaining weight. So good protein, good fat, fiber, lot of fruits and vegetables.
And healthy snacking.
Healthy snacking.
And nuts and seeds are really good snacks in between.
Some good grains, like there is not only the gluten is, I don't say like everybody can't eat gluten, but some individuals may cannot. And then there is like these days, like the quinoa is great, amaranth is great, that has a lot of protein and amino acids, especially for my vegetarian listeners. Those are the good grains, and I will go over it a little bit more later. Thank you, caller.
So this is a really good suggestion, Dr. Anju, which you have given. I think this was a great question which was put in, because I definitely see people who are underweight, and if you do not find any clinical signs what it might have caused the underweight, there is definitely component of nutritional deficiencies. That means these are the individuals who are not having caloric intake according to your activity.
Yes.
If you are active individual who work out all day, or you have a job which requires a heavy work, and your caloric intake is not justified, you will have an excessive weight loss. And I have seen those individuals where they say, oh, we work 10 to 12 hours and we have a standing job, we are moving heavy things around, we are moving heavy boxes and constantly working on it. And when you look into their caloric intake, it's not justifying. So in a standard person, I think usually we said you need to make sure you consume minimum 22 to 2400 caloric intake, somebody who's working moderately. And if your work even requires, if you're working out even more, and you might go a little bit higher calorie.
Yeah, but not for the obese patients, not for the overweight patients.
Well, we're talking about underweight.
Underweight patients.
Definitely.
Underweight people, sorry.
Underweight. So we definitely working. And there are other reason why people can have a potential weight loss is adrenal diseases like Addison disease. That need to be looked at, and by correcting that, these individuals can really gain weight. And we definitely also want to make sure that sometimes people are not eating because they might have psychological issues like depression and all that. By addressing that issue, people sometimes when they're depressed, they don't eat, and that leads to a weight loss. And then also sometimes gallbladder diseases. That also, if they cannot, they eat, they feel sick, they avoid eating,
Yes.
and that leads to weight.
That is getting very common these days as well.
Gallbladder gallstones are fairly common especially in the women.
Yeah, and especially I think the diet is then factor too, because this diet is these days is not really good. Eating fast food and so that will tend to the gallbladder stones, and then they can have the problem secondary to that.
And sometimes people who are diabetic, they don't know that they have diabetes.
Yes, that is another thing.
Then they lose muscle very quickly, and they are getting underweight, and they don't realize. And the only time they will find out, somebody takes them to the doctor and they test it.
And sometimes individuals don't like to go to the doctors and don't like to get a blood work done for any reason. And sometimes if children excessive weight loss, and they need to be taken to the doctor so they can assess, like they might be having the diabetes type 1.
Right, and that needs to be looked into.
That need to be looked at.
As soon you correct the
Yes.
insulin and their eating pattern comes normal, they start gaining weight. The other things are the heart failure patients, because they can't. They are having issues because of due to the heart not functioning properly. They can lead to have a weight loss as well. And then we talked about the thyroid condition that need to be corrected. Once you correct the thyroid condition, they will start gaining weight. And certain medication also leads to a weight loss. And then there is a Parkinson disease, and these individuals also can have excessive weight loss because they're just not able to eat properly because of the difficulties in chewing and putting food, and also the hormonal issues which body goes through in this individual that can lead to a weight loss. And other is the substance abuse. These individuals who are alcoholics, severe alcoholics, can have a severe weight loss because their liver failure can happen, and cirrhosis, which is a almost end stage liver disease. If that happens, these are the individuals who get so thin so quickly that they really lose weight very quickly. And then or cocaine addiction, and I have seen those individuals who have been addicted to the drugs, street drugs, also
they will have hard time
in gaining weight, but then also they have hard time in surviving. We mentioned about tuberculosis. That's that's common in Southeast Asian populations. Make sure you get yourself checked. If you have a cough or your fevers which do not go away, get yourself checked. Make sure the TB is not hiding. And these days I think it is coming back, so it needs to be looked at. Other things like ulcerative colitis type of issues which can lead to a weight loss. So anyway, Dr. Anju, so these are the certain conditions which lead to the weight loss and causing people underweight. I want you to, like I promised, that I want you to give us a Ayurvedic diet component.
Definitely I would love to go that, like as I mentioned a little bit earlier, that we all have a constitution, we all have the we call it prakriti, which is the we have 3 types of doshas: vata, pitta, kapha, air, fire and water. And balance of all these 3 doshas it creates a healthy condition. And but whenever there is an imbalance in one or more, can create some issue. And the weight loss or the severe weight loss is a vata imbalance too. So vata is light, and some people has this constitution as their prakriti, so they have tendency to be light. So they have tendency not to gain too much weight. But when there is more imbalance into their constitution, then it's called vikriti. Then it's a problem. They can have severe weight loss, and so how to balance that? So in Ayurvedic, I will just touch. I don't have a lot of time. So we need to balance first the Agni, which is the digestive fire in the body, according to Ayurveda. And how we can do that. So definitely we need to see first, like as we mentioned earlier, that what can be the reasons, and then there is by eating properly, start eating proper food, and according to what you can digest, or like if you are sensitive to certain foods, try to avoid those foods, and then add then add the good fats, as we talked a little bit earlier, and that will, and the chewing is very important, and the hydration is very important for a good digestifier. And then there is few supplements can be given to support the digestifier. Is the triphala, which is great, and I think most of the people know about the triphala. And haritaki is the one of the single ingredient from the trifle, is great for the to balance the vata constitution.
And also I think the people who kind of have a poor digestion, the ginger actually helps, and black pepper and long pepper,
and the saunf.
And the fennel
seeds would be great for that too, to help with the digestifier. And the ashwagandha would be the great for the...
It's a good muscle builder.
Muscle builder and a vata balancer too.
Right, and it also balances out the adrenal glands. So, this is one of the things which you can consume.
So these are the few simple tips I want to give. And then for the Dr. Shailinder recipes, wanted me to give some of the recipes for the patients or the people who are
gluten sensitive. Why don't we
let's talk about that a little bit. So I use the different flours, like the amaranth is one of those, and buckwheat flour can be used. So if you want to make the gluten-free roti, amaranth flour, brown rice flour, quinoa flour, you can take in the equal amount. And then for the binding, I suggest tapioca flour or the xanthan gum to bind, because problem with these flours are these are hard to bind. And then for the fiber, I do add some flaxseed powder into it, and sometimes just the hemp chia flax powder. I made these all just grind together, and I put those for the fiber in it. And to make that dough, just make it with the very hot water, and so you can mix it with the spoon or something. If you have the dough maker machine, then you can make the dough into that. And really, folks, it's you can make that just like you make the roti, you can make it with it too. So the flour I mentioned is the amaranth flour, quinoa flour, brown rice flour, and the tapioca flour. So this is the great.
This is good for the gluten sensitivity.
Good for the gluten sensitivity bread. You can make that like the roti or the, and then also with the same ingredients, like the people with the having not able to gain weight. So hemp, chia seeds, I would like to make suggest them. Like you can make the same like some healthy snacks. So use hemp, chia seeds. You can use the amaranth flour. Like you can make some laddus with that too. So by like the just amaranth flour into the ghee, and you can add a lot of.
So what is your take on adding some nuts and seeds?
Nuts and seeds, that's what I'm saying, like the almonds, walnuts, hemp, chia, flax, all these are the good fats. So that can be added into that. And for the sugar need to be, we are not saying to gain weight, eat a lot of sugar. So you need to, that would not solve the problem. So by adding the dates and the figs, it really gives the binding, and you can make a healthy snack for those individuals.
And also the good source of amino acid, which can come from the proteins and the beans, really play a role.
Yes.
So if you are a vegetarian, definitely you need to take some good amino acids, as well as, because those are these are the chain blocks for the muscles. So you need to have some amino acid therapies. And also those of you who can eat meat, you need to bring fish and chicken.
Fish, it should be wild. It's like the tuna has a heavy metal toxicity, and the farm raised fish has a heavy metal toxicity. So we suggest our patients or people to avoid those fish.
Cold water fish.
Fish.
And Alaskan salmons are really good, clean so far. Yes. We are lucky to have that in Seattle area. So those are that's a good fish to have.
And the organic chicken can be eaten too.
Right.
So those would be good. And
the people who have a little bit weak digestion, if you can't handle the heavy proteins, then I would advise you to go with the soups
and the ginger powder. Have ginger. Ginger really helps with the digestifier. If taking ginger powder a little bit into the water, half teaspoon before the meals, can really help with
that. So having a good combination of complex carbohydrate, fats and proteins, and eating more often will help you to gain some weight. But remember, folks, if you can work out, exercise routinely, then you can also make muscles. What happens is when you work out exercise, your body has a tendency to get the muscle strength gaining, and you will build a muscle really nicely. So that is good. So start with lightweight exercise, walk every day, and develop a routine of healthy
and
eating.
if you need to see, our clinic number is 425-453-8022. We will be happy to assist you.
Yeah. Okay. Then enjoy your day, and we love to see you next time.